So welcome to the panel on research and community engagement. We have 3 different projects that are represented, and I thought I would let each one of the people who are on the roundtable introduce themselves and the project. So Laura, if you'd like to start.
Yes, of course. How are we doing with, where am I? I'm not, oh, it's turned around the other way. Do you want to turn the camera? Are you doing?
It's been like this, yeah, it's the way they set it up. We had IT problems first thing.
Oh, okay. That's fine. I don't need to be on screen, that's fine. We just did it differently in the other ones I've been in. Okay, so hi everybody. People who aren't here, you might want to go and do that outside. So I'm going to be talking about the course I'm teaching in contemporary menstrual studies. So I'm just going to stand over here because otherwise I've got a bank of stuff in front of me. So I started teaching this course in 2002, so it's now in its 3rd year. And I started it for 2 main reasons. One, to bridge the gap somewhat between different parts of the menstrual landscape. So people who were studying in what's called menstruality, where they were studying Red School, or with people in other parts of the world with menstrual activism and with menstrual academia, so that there was more of a conversation between these parts of the menstrual landscape that are often rather separated, and also to teach in an interdisciplinary way, which at that point and still actually wasn't possible in an educational institution. So I decided to set up by myself and do it, and it's working really well, I think, and there are some really good outcomes. I'll come to that in a minute. So it's a master's level course. There's people who've attended it from about 20 countries so far. So from all over the world. So Australia, New Zealand, Indonesia, India, Nepal, Pakistan, Iran, from Africa, Sudan and Ghana, Europe, Netherlands, Germany, Belgium, Serbia, the UK, the USA, Mexico, Colombia, Brazil, Uruguay and Chile. And so that's really fascinating to have a group from, different countries, all with their own cultural context. And it's really shown up how much there is an incredible universality about menstrual experience, but there are also clear regional differences. And one of the interesting things about who's showing up for the course is how many people are expatriate, how many people have lived in at least one other country than the country they were born in. So that's more than, I think it's about 2/3 of the participants. There have been 55 people who've come through the course to date. I think around 2/3 have that background. And I don't really understand why it should be such a high percentage, other than that I think it takes a lot of courage to study menstruation, and that that's something that's really important for people who are adventurous and want to go and live in another culture. And so the people who are attending are probably about 50% are either already doing a PhD or are on the way towards doing a PhD, so they want help with understanding the research landscape. And it's often they will have supervisors who actually don't have menstrual expertise, because there's still so few people who can supervise PhDs with a deep knowledge of menstruation. And there are also then people who've studied in one of the places like Red School and the other schools I was mentioning, who have got a lot of anecdotal and lived experience information, but don't understand where that sits in terms of knowledge production on a possibly slightly more objective, or at least a more informed academic platform. And one of the sort of most significant outcomes that I'm seeing is how much confidence people leave the course with, that knowing how to read research papers, understanding the history of knowledge that we have about menstruation and all the huge gaps, all the things we don't know, just really, it enables people to go further with their careers. It's still a struggle to build a career in menstruation, but it's becoming much more possible. There are various possibilities for it that didn't exist even 5 years ago. And just seeing this conference and how it's grown over the last few years is really awesome. And what I've seen from 2022, when I first started teaching the course, to now, 3 years later, is that everybody coming in each year, people know more when they enter the course, because the general pool of knowledge in the topic is just getting stronger all the time. So I just wanted to give you, have I got some time still? Is anyone keeping track?
Oh, I wasn't.
Okay. So I just wanted to tell you something about the research topics, because it's a master's course, so everyone does a piece of their own research in the year. And the topics that they've undertaken, there are certain themes coming through. So there's been quite a lot of interest in menarche, and particularly in studying disadvantaged girls at menarche, and looking at what support they do and don't get and what they need. There's quite a bit of work on menstrual health and hygiene, particularly from people, as you would expect, from people in parts of the world where that's really a strong issue. And then there's also been some really interesting research on areas that haven't been studied yet academically, like free bleeding. More work on, we have seen some work on ritual, but a lot more work on ritual and sort of contemporary spirituality. And then a lot of work coming out of Latin America, particularly studying menstrual activism in Latin America, which is a burgeoning field, but has not been studied yet. And then also an interest in community and how women's communities can be built through the menstrual cycle and various ways in which that can happen. And a whole load of other things, but that's just a snapshot. Thank you.
Thank you. The next speaker is Acushla Young. If I mispronounced your name, please correct me. Did I pronounce it incorrectly? Yeah. I'm sorry. Please. Okay.
Hi. Oh, okay. Yeah, my name's Acushla. So I'm a community engagement specialist, very much kind of within menstrual health and also RSE. I'm also the director of programs of development at Women's International, which is a period menstrual health organisation based in the UK, but they also have a base in Uganda as well. I'm also the safeguarding trustee at Girls Friendly Society, which is an organisation that has groups across England and Wales, works with particularly marginalised and vulnerable young girls to help them build friendships and to help them be more confident in school. I don't have a specific project to talk about, so I was just going to kind of talk about a few different things I've been involved with. So a lot of the work that I do, and I think the reason that I'm kind of here, is to talk about how to engage horrible term, hard to reach communities. As someone who's kind of worked within the community space, especially in Sheffield and South Yorkshire, you become quite like a trusted person within varying communities. And I think that that's something that can be like a real gatekeeper between academics and communities to bring those things together. And that's often what I try and do, is essentially work with academics who have funding and have interests, and put them together with a charity or a community organisation that again has similar interests and wants to find out the same things and will benefit from each other's knowledge exchange. Yeah, so another thing I've been involved with also is the RSE curriculum across England, specifically around being faith inclusive. So thinking about how young people from different faiths might want to engage in relationships and sex education and menstrual health in the classroom, and what that actually looks like. Yeah, I think I'm just going to leave it there. Thank you.
Thank you. And then the next two speakers are my co-collaborators. So it's Bethany, Samuelson, Bannow, who's on the screen now. And then also Gabriella Figueroa, who is an undergrad who works with us as well. So Bethany, I'm going to let you describe the project because people here have been hearing from me all day.
Lucky them. Marybec is great. So
We're
yeah,
also very supportive of one another. So
we are. So as Dr. Griffin said, I'm Bethany Samuelson Bannow. I'm a hematologist in Portland, Oregon, in the States. And Marybec and I got connected via Twitter, as a surprising number of good things happen, because we were both passionate about menstrual health and women's health and things like that. And we started creating a collaboration called Dr. Period Hackers, which is right now primarily a Twitter account, or X account, I guess, dedicated to improving education around menstruation and providing accurate medical information, providing just a space to talk about things and share information, really trying to normalize discussion around menstruation. But we are both academic researchers, and so we had to go there too. And we decided to start with a survey study. And by this point, we had pulled in several of Marybec's current and former students, including Gabby Figueroa, who is also here, I understand. And we created a survey just asking a lot of things about menstruation, like what do people perceive as normal? Are they comfortable talking to their doctor? Slang, practices around athletics and menstruation, things like that, a ton of questions. And we have completed the survey. We actually pulled in a colleague of mine who's a medical sociologist. So really, truly multidisciplinary team. And we are currently analyzing that data right now to try to understand a little bit more about sort of the landscape of menstrual knowledge and understanding, so we can hopefully start to create some targeted interventions to really improve that understanding, using our Dr. Period Hackers platform as well as others.
Gabby, is there anything you'd like to add?
I don't think there really is anything for me to add to that, but I could just say that the way I came into this was I took a class with Dr. Griffin, and she was just so amazing. And I did a project on period poverty, especially in women's prisons. And I'm still learning a lot about, I think, menstrual equity and inequities in education and all of the different ways that it intersects with life. And working on this project has been really educational.
I think just two things I'd like to maybe add. We are an interdisciplinary research collaboration. So we have Bethany, who's a hematologist, so a medical doctor. We have people who are medical sociologists. I'm in public health. Gabby is now a master's student in public health. We have people who are art historians who work with us. We work with people in criminal justice settings as well, so looking at menstruation in carceral settings, prisons and jails and things like that. So truly interdisciplinary, also intergenerational, people like Bethany and I who are maybe late early career to possibly beginning of middle career, and people who are undergrads, master students, doctoral level students. So really looking at community that way. And also creating community in online forum. What's interesting is I've met all of you who are here in the UK. I have never met Bethany, and we are from the same country. So we only know each other through this virtual space. So I think also thinking about community in different ways, and that it doesn't always have to be done in person. And all of our research meetings are obviously online, since Bethany and I are on opposite. For those of you who don't know the geography of the United States, I'm in New York, so I'm on the East Coast, and Bethany is in Portland, which is on the West Coast. So we literally couldn't be further from. Oh, sorry. Well, I was looking at my own. However it works. I'm dyslexic. So yes, this way. So we literally couldn't be further apart in our own country. And yet we were still able to come together and to create something. And I think that's unique and beautiful. And we met because a high school friend of mine who doesn't know Bethany connected us on Twitter. So also through an intermediary who doesn't know Bethany and I hadn't really spoken to in person since I graduated from high school many decades ago. So yeah. So now I'd like to open it up to all of you to ask questions. We have some that we could pose, but I think it's more interesting if the session meets your needs, and we'd like to hear from all of you. I'll do my question fingers. I do this in class all the time because I find that when I do this, people's questions, they ask them, they brings the questions out. Plus I get to feel like a witch, which I really enjoy. Yes, my new friend.
So, right, let me try to articulate this. So, talking about in your research and asking participants how they discuss menstruation, did you find that because when I've been doing a lot of research on menstruation and filmic representation, it always starts off where they talk about their own experience, but their own, and like when they're coming of age and experience like their first period, and it's always a pop culture reference is what they use to discuss that experience, but it doesn't really change regardless of what point in their kind of menstrual journey they're in. Did you find that you had that with a lot of participants? And if you did or didn't, did it kind of change depending on their age bracket? Because another kind of thing that I've found is that with younger audiences, because of the fact they find out so much about the menstrual journey online and on TikTok especially, that pop culture, whilst it's still used to discuss menstruation, isn't used as much with a younger generations.
We didn't ask a question about where people first heard about menstruation. We just asked about sex ed.
But in general, when they discussed it, was like pop culture.
No, it wasn't
like.
No, it wasn't mentioned at all. And we do have like open-ended questions like that, but nobody mentioned it. We did ask about adverts that people remembered seeing and how that might have impacted it, but not pop culture. It's a missed opportunity. And now I want to ask. See, the problem when you do survey research is you always get a question like, did you ask this question? You're like, no, but I wish I had. Next time.
I'll be asking it in my
and no, nobody mentioned any pop culture references. Yeah.
Seems to be as your
Yeah.
Yeah.
And there's an interesting thing about Judy Blume's book, it's like
yeah.
So that actually was published in the early 70s, I think, but it didn't it became big in the UK around 1990.
Yeah.
So there's a generation of people who were coming of age in the early 90s who in that book was a massive influence.
Yeah.
So that's something that people talk about in my course, for example, when we're talking about the history of pop culture and so and then there's other things like people who came of age in the mid 70s often we talk about charities.
Yeah.
So there's something big for different generations, and maybe now it doesn't have to something pop culture so much because it is being talked about more.
Because it's like sometimes I sit and I wonder if the pop culture references I make are purely based because I'm like such a film fan, or whether it's an age thing, but then usually the references I make into films from the 90s, so like Hollywood. My brain's just completely went blank on any other example of like Clueless, but it's still a great example. But I just have found that considering as well in academia that it's so kind of frowned upon usually to discuss your own experiences, but when it comes to menstruation, it seems to be the opening introduction. It's like, well, when I was young and I watched this film, or I thought about The Shining, that's one of those. But about The Shining, for instance, it's interesting whether that's reflected in kind of public surveys as opposed to something I've just found when I'm reading academic research.
Yeah, there's not enough research being done on that. Maria will know more about that. Sorry.
Yeah, no, please don't. I don't need to acknowledge anybody. I have no power.
Yeah. So I would do a lot of work in Maria. And one of the things that I think that I'm doing her research and what I'm doing from her research as well is as you say, like the referencing and like to movies especially, and like online, like what things we talk about.
Good for her.
Yeah. And so I think like there is a generational difference, as we were saying. I think that millennials love a meme. Millennials are obsessed with like, matching something to the in the 90s or the early 2000s. I think that generally younger are less that way inclined. From I think what we could tell from the research. But the other thing I just wanted to mention is how you're saying about having some ways it's kind of seen as like four forms that talk about your own experience within menstruation and academia.
Yeah.
There's kind of interesting conversation about that, as whether that's actually quite like a colonial way of thinking, and actually really should be like centering ourselves a little bit more within our research. I understand, you know, subjectivity, we need to really think about institutionality, but whether actually positioning ourselves in saying, actually, I have had these experiences which are going to impact my data, they are going to impact my lifestyle, is actually something that maybe we shy away from it too much.
Is it something I really like? I feel very strongly about doing in my work because so much of my work is inspired from my own menstrual journey. And the fact is, what I've discussed with so many people I've met today is I've always been very lucky and privileged. I felt comfortable enough to very viscerally talk about it. Again, using Philip references half the time. But it's kind of, it's been interesting because working class studies and menstrual studies are the two spaces where I found that these experiences, while other areas of academia look down on it, it's not been, you know, so much of an issue per se. Yeah, that's the end of my point. But
Well, yeah, so it's a core tenet of feminist methodology,
Yeah.
actually, that we need to hear women's voices because they would have been raised in history for so long. You know, history was written by men, about men. And so in order to, you know, correct the record, it's very important that we think our own experiences.
So one of the things that, oh, I'm sorry.
Well, just an autoethnography as a method is being used more and more.
Is that, that was actually gonna be my question, like, I was literally just talking to supervisors this week, like, is autoethnography more welcome in the national space? Is it inevitable? Depending on the studying and what it's qualitative, and is it, like, are there recommended approaches for if you're doing co-design that your autoethnographic frame doesn't take over? And
Explain what auto thingy means.
so it's like your autobiographical information being inserted into the research.
No, it's not.
Like,
That's not autoethnography.
well, I was simplifying.
Yeah.
Simplified too far,
Yeah.
sorry.
So it's using yourself as a subject in your research and using an ethnographic methodology, which is not the same as photography. So it's not only telling your own life story, it's also being able to reflect on it in legal writing. So it's self-reflexive.
So my question is, how ethically, if I also wanted to do co-design, but it's becoming autoethnography, as a researcher, I don't want to position myself higher than the co-participants. Is it kind of becoming de facto participatory research rather than co-design at that point? Or is there a way for me to still manage? Is this something other people experience? Is there a way to manage co-design where you are also working from autoethnography?
Yeah, definitely. And you can say it's your you know, maybe different people or whatever you've done to get the data, and then you say you're structuring it through autoethnography. That's one way to do it.
Yeah.
And then your autoethnography is a link and refrain that pops up here and there, and then you intersperse your data with it. That's completely
That detract from the people's experiences and their ability to cultivate the research. Like, are you, like, I guess that's something for everyone to do. Like, is our participants co-shaping the research in a way that's like valuable for them and the researcher?
There's some principles of social science research that would really help you with this, like the principles of witness and witnessing, that you do both together. So there's various things that are part of, you know, the autoethnographic and or, you know, feminist methodology.
Okay, I'll stop with that.
So it's possible, yes, you can do that.
Thank you.
I think it's also important to remember that the reason, I think, at least for me, why we do this research is because research is niche search. We're trying to understand our own experiences in the world. Like I ask questions about my own experience and reflect on them, obviously in a distanced way through mixed methods and things like that. But I'm inherently interested in the subjects that I'm interested in because it's my own experience. So yeah, I think at the end of the day, there's always kind of that centralizing of yourself. That, right, like we're all humans, we're all somewhat self-interested. We want to understand ourselves, I think, like a normal. There's a question in the chat that I want to make sure that we get to from Amelia. It's a question for the Dr. Period Hackers group. Thank you for the name, kudos. Colleagues and I are also working on a very interdisciplinary space in menstrual health and have had many challenges. I wonder what some of the lessons learned are from your work and what advice do you have for others to connect between disciplines? You know, Bethany, Gabby, do you want to start? Do you have anything?
Go for it, Gabby, and then I have some thoughts.
I think it is definitely very interesting. I didn't realize when I first met Bethany that she was an actual like practicing doctor. And she can just provide a perspective that's just so much more knowledgeable than the public health side because she understands way more about the functionality of the human body and bleeding disorders. And I don't really know if we've encountered any challenges because of it. I feel like it's probably more of a strength of this research duo between her and Dr. Griffin. But I think it definitely did show me, and I was as an undergraduate student at the time, that it's really important to pull from these different perspectives because we need to have both the medical knowledge and the social knowledge to really expand on how you're going to interact with the community.
I mean, I feel like this has been overall a very easy experience for me. And I attribute no small part of that to luck because Marybec and I just click. We get along really well. We think a lot alike. And I realize that's not like a helpful piece of advice because you don't always have that control over your own lives. But I would say shared vision is really important. I think some aspect to it, honestly, is getting to work with women. I love working with women, but neither Marybec or I are here for our egos or to pad our CVs. Like, we're here because we truly passionately care about improving the landscape for menstruators of all kinds. And so I think, making sure that you're on the same page in terms of vision from the very start is critical. And I think maybe less from this interaction than from other interactions that I've had where we don't necessarily click as easily is, you want to set expectations and goals up front, right? Like, talk about what each person is bringing to the table, like what are the expectations, like what are the deliverables, things like that. I think that's really helpful to be clear. I think it's, important to understand how. For me, it's important to understand actually how little I bring to the table. Like, it's really interesting to hear Gabby say that she feels like I bring this extra knowledge because I feel constantly humbled by my colleagues in public health, my medical sociology colleague, like all of these things that hugely impact patients and menstruators that I just don't think about in my day-to-day basis, right? I can think about the biology, I can think about the medications, but how that information gets disseminated, what are sociological factors, economic factors, education factors that impact this. So I think really just listening to each other, recognizing what everybody brings to the table, having a spirit of humility, and being very direct and open and honest, I think is key.
So Amelia has a follow-up question, but before I get to that, the other thing I want to say is I think the key thing that's made it easy is whenever anyone expresses any kind of interest in menstruation, whatever discipline they're from, Bethany and I are just like, yes. Like, I think I've said this to a couple of people here, I think my most American trait is that I love to be helpful, and I like to connect with people and hear what they're learning and learn things. And I think all of us in this room are just like endlessly curious. So that's been one thing. And the other thing is thinking about what we are right now and what we want to grow into, and realizing that there are today things and that there are next year things that we want to get to. And then 5 years down the road, like Bethany and I have talked many, many times about setting ourselves up as a nonprofit so that we could accept donations outside of academia for research, or then giving out period products and things like that in the community, which is something that we can't do in an academic space, but recognizing that we are limited because Bethany's at a medical school and my department is under a medical school, just realizing that there are things that we can't do in this exact moment. And then when there are partners that reach out to us, like the National Hemophilia Foundation, being like, yes, like we think that there is something that we can do here. Or if somebody has a question, recognizing when we're not the experts and bringing in people. We work with another young researcher, young early career researcher, Tess Olson, who is a trans menstruator, and they create a lot of our trans menstruation content. So knowing when we're not the experts in the room. And then to get to the more blunt question, we've had trouble getting key and influential physicians and biomedically trained colleagues to appreciate the importance and expertise of social behavioral science, qualitative research, etc. I don't know, Bethany, can you, I mean, you live this exact thing. I mean, and qualitative research is just, I feel like, never taken seriously because we live in a capitalist society that loves numbers, and that's why quant is preferred, but it's garbage, to be frank, right? Like, we're all humans at the end of the day, and that's what qual research is. But Bethany, if you want to speak to this a bit more, maybe.
Yeah. Well, first of all, I'm sorry that you had that experience. There's like really no excuse for that in my book. I mean, just probably one of the greatest lessons I've learned in life in general is you can't make somebody appreciate you. Like, no matter how worthy of appreciation you are, which everybody in this room is, which like social behavioral expertise and qualitative research is, it's, you can lead a horse to water, but you can't make them drink. I think probably the key is, you know, maybe to keep looking until you find somebody that you click with, and then really build upon that area. You know, I would say that also traditionally when we think about menstrual health, we think about gynecologists, which is totally fair. But if you can try to look a little bit outside of that, so if you think about, you know, are there GPs who would be interested? Are there people like me in hematology who would be interested? You know, can you expand your reach a little bit? Certainly, you know, you can reach out to me. I'll put my email in the chat, and I have some connections. I don't know if you're from the UK or not. I have at least one or two connections in the UK that I might be able to help you with. Yeah, it's tough. It's not okay. And you know, I think that's something. I mean, the thing that I keep coming back to in my career is culture change. We need culture change on so many levels. So again, I'm sorry that's your experience. I wish I had some, like, all you have to say is these magic words and they'll appreciate you. But I'm a realist, and I think you just kind of gotta keep hammering at it.
It's a really great question. Are there other questions? I see my question fingers again. Oh my God, see, it works every time. I don't know if these handles first or wants to first. And then we'll go to you next.
So my question is, building on the learning experiences of this interdisciplinary work, and mostly about the pace in which we work into students with our partnerships between research and academia, and then there's the activists and the people who make it happen on the ground. And I'm in that cohort, and I think the thing we share is that there's never enough resources for me to do anything in both situations. But equally, we're like, no wisdom to us, right? So there's no time to waste. And with the increased sense of appreciation for research and making sure that every action and intervention is backed with research, I think there's a huge difference in pace in which you do these interventions, right? Like, how do you manage and navigate that with the two different roles?
Yeah, so the other thing to mention with our collaboration is we have no funding. So Bethany and I get no funding from either one of our institutions for this. So we're doing this as part of our academic work, but that's not supported by the university. So it's a lot of, yeah, you're right. Like, it's a thing that takes time. Also, if I can disclose, Bethany just had her second child like 6 months ago. So like that also, like, just the process of being a human and experiencing reproduction has also slowed things down. But it's one of those things, like, yes, like I don't know how to answer or to manage that. Like, I don't know how to answer the question, because it's one of those things, right? Like, it's just, I don't know, we just do. And
Yeah, I sorry, I'm giving a very specific example. I have a workshop that I
Mhm. Right.
4 weekends researching what's already been done, essentially baseline, making sure we have solid surveys, make sure our intervention is solid, and you know, and I understand the importance of all of that, but there's so a need.
Yeah.
I'm really good at it. I think the thing I do work with the shows.
Right, yeah.
Last time. It's just.
Well, I think what's important for all of us to, really reflect upon is how new this field is. So yes, people have been writing and talking in sort of growing numbers over the last few decades, but it's really only in the last 10 years. And then specifically since around 2016 that menstruation started to really become something that, there are far more NGOs. There are so many more PhD students at this conference than I've ever seen before. So it's very new. So we don't yet have the structures to support the work that we do, and that would bring together NGOs with researchers in the way that we're working and do now. And that's one of the reasons I'm teaching in the way that I am, because I'm encouraging those relationships between people who are passionate about the topic and to learn each other's language and to be able to talk to each other and maybe start to flow a bit more between those different roles. So it's not so much that people are in different pockets, because it's exactly right that you say that we need to have a much more, mature way of operating, but we're still in actually the early stages. So we have to have a bit of patience. And it is very frustrating because it's also hard to, I hate this expression, but to monetize the work that many of us work for, a very low level of pay or no pay. And this is you're talking about. So that's another thing that we have to sort out. And gradually, menstruation is, developing more capital association, both, social capital, symbolic capital, and financial capital. It's starting to improve, but it's a stigmatized topic. It's a very young field.
Yeah, oh my gosh, please.
Yeah, and this is, I feel like we're kind of in a way, because I feel like I'm in the middle of this, in sense like like around this. And I think there's a few ways in which to manage it. And I think that one of the things for me is like setting through the expectations for the people who work with participants or community groups versus like, because often the expectations become really different. So I think it's like from the offset saying, look, this is what we're able to do, and this is what we're not able to do. I've got major learning points today. It's really hard.
Also thinking too, if you're bringing in government, that they often work on a very glacial pace, or at least when I've worked for the government, it was absolutely glacial.
Yes, and yeah. So going on from that, I think that what really the difference in urgency. So for example, like if you're an academic and you see the word urgent in a manual, that generally means something to do, it's a paper that's due, with funding, with something you need to write something. Whereas when you're an activist with a community worker and you see the word urgent, it's I'm a single mom, 5 kids, I'm getting a book to stay, I'm going to be home this time. That has to be, that is different in urgency, I suppose. I don't have to keep saying that because I know that could be really stressful. But yeah, exactly. It's just kind of like obviously things are urgent, but then there needs patience and there needs to be understanding of what community activists actually do every single day to bring these people together and to achieve their say.
Maybe simple things.
They're not urgent in terms of like
Yeah. But also community workers, it can be like.
Maybe things like timelining and Gantt charts and stuff like that could help. So that way you're just like you're saying what the timelines that you work on and what now means in each setting. It helps. Yeah. Did you have something to add? Yeah. I don't know. Was it something to add to this or? Yeah. Can we jump here and then yeah.
You can do the follow-up.
Okay, then let's do the follow-up question.
Days, we're gonna post like a lot of that ones. It's on the ground, or even from research being done in the communities that would help research by people. So I'm curious to know, like, have you seen examples where that knowledge is given new life, or
place of reaching people that can be impacted by those findings.
So the women's environmental it's very active in the 90s, looking at in response to the tampon talk stuff from earlier.
Speak up, sorry.
Sorry. Environmental was a campaign by the Women's Environmental Network. They were very active in the 90s, and had like sort of sibling groups in the US of what was SCAC, looking at the toxicity of menstrual products and the ingredients of them. And then when period poverty hit the news, the Women's Environmental Network decided to revisit their environmental campaign because there seemed to be a new audience for it. There's a lot of staff and volunteer turnover. So I was one of the people they called up to say, hey, could you tell us what's new? And I did a session about what's new. But a lot of it was me signposting about what was already existing and how I synthesized it. And they built that into their newer messaging. And they're absolutely going strong now. And that is an example of them sort of resurging based on the audience being available and taking their old sort of citizen science action and channeling it into a lot of new valuable campaigns.
I think it's also things like new media and podcasts. And I think one thing that academics don't always do well is speak to the media and speak in like very clear terms. So like whenever possible, I've taken like media training classes and provide comment to journalists and things like that. I think that's another way of like reaching audiences. Bethany actually wrote a paper that exploded like a year ago. I don't know if you maybe want to mention that. And you like.
Yeah, sorry. My audio has been cutting in and out a little bit, so I'm not sure I totally heard the question, but
it's about reaching diverse audiences and things like that. And how we can, yeah.
Yeah, I mean, I think the media is an incredibly powerful tool if you can get them interested. And I would say, you know, I mean, so one of the things that I teach my trainees when they're advancing in their careers is this idea of having an elevator speech. And it's like a 1 to 2 minute talk. The idea is, I mean, when we used to do things in person, like, what can you say when you're writing from like the first floor to the 5th floor in an elevator? Because that may be all the time that you have with a media person or whoever else, and just really being able to summarize like the heart of what your goal is, your organization's goal, whatever it is. So I would work on that, and when you practice it a lot, you get really good at it and really comfortable with it. And it also, I think, helps to really think about like de-jargoning. I think to Marybec's point about academics, like the fortunate thing about being an MD is that I am forced to practice like 99% of the talking that I do about periods is with people who aren't in academics and they don't have training around periods. And so I am forced to like de-jargon my words. And I found that very helpful when I'm talking to media as well. It's also helpful to like be concise and to the point, even though I know I'm like talking a lot here and using my hands. In theory, being concise is better.
Yeah, can we hear Acushla answers the question?
Yeah.
Yes. Again, my brain is so bad, but I think I remember your question.
Are you seeing cases where the knowledge that you have, right? Like you have unique insights. Experiencing, like, do you see this being reflected in like when these people what you can do?
Yeah. So I think like when I first kind of start thinking about knowledge, I think people think about sort of academic intellectual knowledge versus like community knowledge and lived experience. And I think like you really can't have academia without lived experience, like that kind of has to come first. And so I think it's about really valuing that and understanding that knowledge from the ground and language that is used on the ground is what people can relate to and understand. So I think sometimes that can get a little bit confused in academia because of the way people write, because it can be quite inaccessible. And so I think that's something that I'm doing with Maria. Not your work is an accessible career, it's very good. But it's kind of like, taking what Maria is doing and being able to translate that for charities. So for example, like if you're going to a charity with a resource that's any more than a few pages, they're not going to read it. They've not got the time and they won't see the value in putting their precious amount of time towards that. So I think it's just about really understanding how communities work and then being able to create resources that really work for them in what way. And it might not be written, it might be a presentation, it might be, I think one of the things that people need to remember with a lot of community work is it's very much in person on the ground. And so if you want to talk to that community, you have to physically go. Don't send them an email, like, like they probably won't reply. So yeah, I think it's about just really getting stuck in to like the community feel, and translating that knowledge in a way that's accessible to people. So that was your question. Your question?
Yeah, and just around how you engage different communities in research, not only just sharing knowledge, but having them involved in research. And it's a bit of a selfish question because with my PhD, I'm really interested in, I find in the UK, a lot of times when we talk about menstruation, it's through equality. In its connotation itself, it's more likely lower socioeconomic background or it's social children. Whereas I'm really interested in adults. And I guess how would you then engage with different communities that are not necessarily straightforward communities, where food banks and so on, where you're more likely to have those people, especially when you're wanting to, the stigma and shame, I guess, is across society, right? So how do you work with different communities? And I guess also, especially with potentially men who might see it as, well, it's got nothing to do with things. I guess how do you engage different communities?
With humility. Seriously, that's a really important quality for a researcher, is that you go in knowing that you don't know. You know, and that's why you're doing research. You want to understand. So you're asking them what their reality is. You're not telling them what they should be thinking or feeling, or what even what menstrual activism is or anything like that. You're just going in and asking, you know, what's your experience, and you ask really open questions and you absorb everything. You don't shut something out till it fits what you've been, you know, taught. So that's why ethnography, I think, is such a popular method for menstrual researchers, because it does train you to understand that you're the one who doesn't know, not the people you're researching. So I think that's just incredibly important for academics, and then that also means that you learn the language that they use. So and also there are you know, ideas out of feminist research, like for example co-creating research, creating research. So when you write it up, checking with them that the way you've written it up actually is, you know, representative of what they said or what they experience or what they do, so that you're never putting yourself into a superior position.
I completely, sorry, I just have to, I completely agree with what you said. I think that as a researcher, you should never go to a space assuming that you have access to that space, and assuming that you have a place there just because you're a researcher, have a PhD, or you know, whatever it might be. Because for a lot of communities, that didn't actually mean very much. I mean, especially talking about going into communities that are vulnerable around women, for example. Like if you're thinking about history of gynecology and research, there's a huge mistrust there, and rightly so. And so I think you as an individual really have to build up more for your repertoire with, for example, community members, so they're the simplest person to trust. And that relationship is really important. And then once you finish your research, don't end the relationship there. Like if you genuinely care about this community, keep going, keep that relationship going. And making sure that you're, once you've done the research, go back to the community and give them something that's tangible to them. Don't just email them, oh, right, okay, there you go. They're not going to read it. Like, you know, go back and say, this is what we've done, and I think we've made fun of this, I'm going to do this with us. Like, invest in the community that you're wanting.
Well, or even the knowledge that you gave me, by sharing it in another context, means that this will then happen.
Exactly. Yeah.
So you don't necessarily have to give them something directly, but you're showing that their information is incredibly important for society as a whole.
Yeah, just extending that was just said doing, especially with is gathering millions of data from our mobile and department and is really it's not spinning it's taking time to give us stories to be all sorts of exchanges. It's been really doing us that emotional exchange being nice to make it work it's very emotional.
I also think thinking about research fatigue and how frequently you're going back and asking, like the timing of research and how frequently you're going back to those same reasons. And making sure that you're always closing that feedback with the dissemination.
Yeah, but especially just the action.
Yeah.
Actual exchange.
Yeah.
Actual exchange.
Yeah.
I think, within the research that I have done and I do, I think the most tangible things are obviously actual conversation. Like, this is the thing, if you ask for an academic to come and give a lecture, you would pay them. But then if you're going to communities, can you please tell me about your trauma and X, Y, Z, and you're not paying them? Like, you don't value that experience, that knowledge. So obviously paying them, also like emotional support as well. So saying to that person, if you want to be part of this and you get financial compensation, but also we have access to counselling. If you need to, process this after you have to relive it again by saying what we're going to say. But I think it's really just about talking to the communities you're engaged in and saying, what do you need? What do you want? Because that's the other part of this assumption is that, you're put in the front of things like an academic and say, this is what I'm going to do and this is how you're going to benefit. And you get to the community and they say, well, actually, we don't want that. So it's communication, flexibility, and valuing people so they say this as much as you would anyone else who's got how many less something.
I think also following off of that is also making sure when you're building in the questions that you're asking about strengths and assets that exist in the community. Because even the most marginalized and disenfranchised groups, they have knowledge and have created workarounds, and acknowledging that I think in the research is really important because we so often we come from perspective of what doesn't exist, but we're not asking about what have you created, what does work, like what can we build on, what is sustainable. So always bringing strengths-based approach. There was like the 3 hands that went up, 1, 2, and yeah.
Yeah, I think the question I was going to ask and answers really good.
Oh, okay.
Out of the last 10 minutes. Yeah, I think another thing as well, I thought we should talk about, and we can shed light on this question because we've had this conversation many times, about kind of traditional distrust between kind of communities and research. Obviously, you touched on a little bit talking about kind of reproductive justice, but what do you think academics should do to try and rebuild that trust? And how to, obviously, you said like include communities when you're applying the research in the first place, ask them what they want. But what do you think academics should try and do? Because I think part of the problem we face is institutional culture. So, for instance, when I applied for a knowledge exchange research and I applied to pay the organisations, I was told at university, but they're getting knowledge from you. So that's what payment they're getting. And you're paying members of the community to go out and deliver the resources. Why are you paying the organisations? I said, well, we're consulting with them. And they're like, but computer says no, there's no one for that. So how can we change institutional culture? Because I think that's what's needed.
Okay, I'll go.
Yeah, please, yeah.
I think the short answer is pay people. It's paying people for their time. But I think also one thing that I think sort of shows me when I'm working with universities is, well, this is the rule, so that's it. And it's like, but rules can actually change.
Well, we've always done it this way, so we must always do it this
like,
way.
You can, within your role as a lecturer, professor, you can advocate to some extent. I understand that there's processes, videos, etc. But if you're not going to do it, nobody is, because participants aren't able to be in that space, and then the people who are kind of sitting at the top with their massive salaries. So, like, if you're in this space where you're researching because you genuinely want to help communities, you need to do it. You need to do the work to make communities have a conversation to say, look, this is the process that currently exists in the it needs to be changed, X, Y, Z. Like,
well, there's another way of doing it as well, which I hear you about that, but the other way is to be a participant researcher. So I'm thinking of Bethany Skett's work, her longitudinal study on women working in care homes, where she started off as a care home worker while she was, doing her undergraduate degree, I think, to finance herself, and then she went on to study them in the PhD. So these were women that she had worked alongside, and she would go back in and be with them. And then the work I did on the menstrual workplace policy at Coexist in Bristol, I initially we were in touch because they wanted advice about their menstrual workplace policy, and I did that pro bono because A, they didn't have any money, and B, I thought I might want to do it as a PhD, and that was how it worked out. So by the time I was doing my PhD, I was already part of the process and I was participating. There's lots of other examples of that. So it's that you're actually with them, but then you have to obviously explain that in your methodology and be really clear about it and have all the relationships really clear and have everybody signed off on what you're doing, including your institution. But that should not fall outside of ethics rules. I managed to get that through because the relationships were all clear in the roles and what would be done. So I think that's, in some ways, that avoids the difficulty of actually paying people, which universities often be born with that. But yeah, it's out there. Our institutions, we can change them for sure.
I think also what you're saying in terms of, I think more academics who are researching things that they haven't experienced of, and that's something which is changing over time. The more we get people into positions, they need to know who experienced hardship, social etc. It's perhaps more like
That's right. And also menstruation is a great arena to do this in because menstrual activism and menstrual academia are actually pretty close. Yeah. And so we've often got a very similar mindset, whichever side of that we're on, and most of us are somewhere in the blurry middle space of it anyway. So
I often say that I'm the most annoyingly difficult person, but in the nicest possible way. So if I come up across something where my university's like, well, we can't do that, I'm like, hey, but why? But maybe we could try this. I'm like, but no, I'm like, but okay, but what about this? And so I think it's also about a certain amount of persistence and sometimes thanking people even when you don't necessarily mean it, and just being very annoyingly positively persistent. That's a lesson I learned from my government days. So but also just being mindful of the time. We only have a few more minutes, but please, yeah.
I'm just curious if I teach at college, so there's a real strong focus on apply, but the college is trying to level up to be more engaged in research. And the thing that I find frustrating and that I can see as well with my colleagues that are at research institutions is that now you're supposed to do it all. So you're supposed to publish academic papers. You're supposed to publish openly accessible outputs, but the institutions are not bending in terms of what they're providing. And I think because of where I am, I'm always like, let's do it first. That's but I have the capacity to do that because we're at institutional research is not expected. But what I feel frustrated about is, I don't know. I'm curious to know if others are experiencing that, and then are you pushing back or are you
welcome to the neoliberal economy?
Well, I think it's we know that mentorship and service is concentrated among femme-identified individuals, queer identified individuals, people of color, like academics of color and things like that. And it's so I'm trying to push back, but I'm also very cognizant. But if I don't do this, the senior lecturer is not going to take this up. So I do have an answer.
Sorry, I was just going to say, building on that sort of partnerships.
Yeah.
We were talking about trust before you say, well, there's loads of people who are established for social communities that we definitely have it there. So you might not just be the face program, which it's not what it should be about. And being saying for that purpose, you don't have to do everything that same kind of narrative. But I think as an academic and research community, we feel like we may have the option to reach out to the activists and the non-profits to maybe establish a partnership. I found it impossible to kind of find a way to get through to the academics other than phone calling, messaging them on LinkedIn, so I think there's if you understanding the importance of these partnerships to reach like that, let's also think about venues and ways in which both parties can find each other because
I'm surprised how many academics there are and how little
you know, in comparison to the people that I've met today, at least, but are here representing the, not taking away that I feel like every academic is an activist in itself, to your point before, but like from a social entrepreneur perspective, but I was so keen, and I was like, hello, let's work with you. How do I do this? How do I get on your radar? So this many good.
You said you had an answer.
Yeah, I was just going to say that sometimes depends on the institution. So because in the UK we have something called the Research Excellence Framework, every 7 years you have to submit your research to be basically given a rating. But part of that is something called the impact case study. So each school or department puts forward one academic that they think has the most impact. So at the University of Sheffield, if you are spotted as one of the people who's having really good impact on society, they will keep supporting you to do that and allocate you time within your research to do that. But it's only for certain people. They flag up that, oh, you could be a case study. Money. But it doesn't. It means that people want to do bits here and there, aren't supported.
Sounds like a discovery, like in Hollywood.
That's literally what it is.
But it also means that academics do have a vested interest in being ultimate.
Yes. Yeah.
All right, thank you so much, everybody, for attending.